I'm sorry you've been in pain so much you've been led to this page, but I'm excited to share some life-changing information with you. I'll give you some powerful keys to stop the damage and the pain and begin the healing. Immediately, perhaps. Hi, I'm Dr. Jay Hobbs, and I'm passionate about helping families restore hope and health. I've been passionate about this in one form or another since 8th grade, and it's continued to drive me to be and deliver the best diagnosis and treatment by practicing for over 25 years. Yes, I'm over 50 now, and getting certifications in neurology, which is brain and nerve diagnosis, and functional medicine, which is nutrition testing and treatment, and non-surgical spinal decompression for the back and neck disc damage, like herniation, sciatic, etc. So I'm going to help you and teach you as I tell you the stories of 4 of my patients, with some name changes, of course. So 4 people that had their lives derailed, their plans in their life, because of pain in their back or their leg or both. Now, it's an investment to get out of pain and get back to what you have to do with your life. But I want one better for you. I want you to see the possibilities of what could be. If you had strength, health, sleep, rest, clear brain function, just a healthy whole body, like it was designed to be. So maybe I'm getting ahead of myself. I know right now you just want to get out of pain, and I'll be laser focused on that from the beginning with you. But if we do this right, it won't just be a quick fix. It can be the beginning of a new you. In the following videos, I'll share patient stories. One of Dr. Brooks, who had numbness and very sharp pain, making him suffer and miss work. He was short on time, and he could afford the best care that money could buy. Then Mark, who was a warehouse worker, shelf stocker, and he was limited on cash and was starting to miss work that his family depended on. Kelly, a mother of an adult disabled child's son, she had to lift frequently, and Roger, a 70-year-old who was scheduled for surgery that came in asking if I could prevent it and get him better. Now, these are all great stories from my patients recovering, but your story is the one that matters most right now. So it starts with thorough consultation and evaluation to determine the source of your pain and the path to pain-free living and healing. So we set aside specific time right up front to listen and to discuss your concerns, because what you think matters. And your history can give us good clues for solutions. The evaluation will likely be the most thorough evaluation you've ever had. We assess the biomechanical contributions, including feet arches, pelvic level, spinal stability, differential deep tissue damage assessment, dysfunctional movement patterns, functional neurology, and more. So watch the videos as much as you like. Give us a call if you have other questions, and schedule an appointment with us for a structural and neurological functional exam to see if your case is right for our treatment. Even if it's not, we'll give you a thorough report of our findings and what we recommend. Have a great day, and may God bless you.